plastic surgeon, a reduction mammoplasty, which is known as a breast reduction, is one of the most common and gratifying procedures that I perform. So many women with large breasts, which is known as macromastia, experience symptoms of back pain, neck pain, headaches, and also have a hard time with a lot of athletic activities. They benefit so much from a reduction. A lot of my patients will even tell me that they notice an improvement in their symptoms immediately after surgery, and they're finally able to participate in other activities. So today I'm going to talk about this article called Optimal Timing for Reduction Mammoplasty in Adolescents. Teenagers with macromastia will experience similar issues in addition to embarrassment and teasing by their peers. But the dilemma for most of us when we're operating on teenagers is knowing when the best time to operate is. Adolescents are still growing, so that means their breasts are going to continue to grow. And it's a fine balance to figure out when they'll benefit both emotionally and physically from a reduction, but also try to avoid an additional surgery later in life due to breast regrowth. In this article, the authors try to predict if there is an optimal time for a breast reduction and if we are better able to predict when the breast will stop growing. The authors reviewed their experience of performing breast reductions in young women between the ages of 12 and 21 over the course of 12 years. They looked at several factors, including the patient's BMI, age at menarche, which is the age when you start your periods, and also the weight of the resected breast tissue. And they also followed these young women in their clinics for several years to determine if their breast size remained stable. In looking at their data, what they found was the age of menarche was associated with the degree of breast hypertrophy. So the earlier you started your periods, the higher the degree of enlargement of the breast tissue. They also learned that the breast growth stabilized later in obese young women when compared with healthy weighted or normal weighted young women. In their study, what they found was that 6% of the patients who had a breast reduction surgery did actually experience regrowth of their breast tissue, and some of these young women did go on to have an additional breast reduction procedure. The authors also created a model using linear regression analysis to predict when the breast growth stabilized. They found that in healthy weighted and normal weighted young women, breast growth stabilized 3 years after menarche. In obese young women, this occurred later, and breast growth did not stabilize until 9 years after menarche. Some women will definitely benefit from a reduction, and due to the increased physical benefits as well as the improvement in self-esteem, and may opt to undergo the surgery despite the risk of requiring an additional surgery later. Other women may opt to wait until breast growth is fully stabilized before having a surgery. But this is something that's important to discuss with every patient, and it's an individual decision made by the patient and her surgeon.